Hey, 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 it's me. Whether you like it or not, we are going to talk about infants and toddlers today, their development, and possible problems for both age groups. First up is the health promotion of the infant and family. According to ATI, an infant is age 2 days old up to 1 year old. The infant period is a time of rapid growth, especially the first 6 months of life. You probably know from Amy's class that newborns lose up to 10% of their birth weight, but as they get older, they double their birth weight by age 6 months and triple it by age 1 year old. So, for example, a newborn that weighs 6 to 9 pounds should weigh approximately 18 to 27 at their first birthday. Their height also increases 1 inch per month for the first 6 months. So lots and lots of growth. They have big growth spurts rather than it being gradual. It's fast. Infants have a lot of sensory changes also the first year of life. They love looking at human faces. By 6 months old, they can tell the difference between a familiar face and a stranger. So that might start with that stranger anxiety. They also can hear at birth. You'll see that in Amy's class when you have a newborn, they will check the hearing. That's a routine screening. All of the body systems are starting to mature throughout the first year of life. Respiration slow down. Remember that infants breathe with their abdomens. They do have some of mom's immunity, but they start to lose that at about 3 months old. That's why immunizations are so important so that these babies aren't at risk for infections and communicable diseases. Their cardiovascular system, they do have sinus arrhythmias. Their heart rate will increase when they take a deep breath and decrease when they have an expiration. So that's something to remember. They do have some of mom's hemoglobin and iron stores until about 5 months old, and then they start to lose those. So that's where that hemopoietic changes come. They can become slightly anemic around 5 months old. Their digestive processes are still really immature. This is evidenced by their stools that are real runny and liquidy, um, and that's why they can't have human food. They have to have formula or breast milk. They have a lot of adipose tissue, so they have good thermoregulation. Renal function is immature yet. Obviously, they don't have control of their bladder. And then they learn to swallow, suck, and breathe around 36 to 38 weeks gestation. Um, their airway is really small, so that's easily blocked. And a reason that we'll talk about later, talk about safety and that they're at increased risk for infections. Fine motor development has a lot of changes through the first year of life. Table 10.4 in your book goes through a huge table of growth and development during infancy. It's really important for ATI and working as a pediatric nurse that you understand what milestones should happen at what age, because if a child is not reaching those milestones, certainly there could be a problem with their development. So for example, they should be able to grasp an object with their hands by 2 to 3 months. Pincer grasp, also I'll show some pictures coming up here at 10 months, and then building a block of towers by 12 months. Those are just some examples. Again, ATI and your book has some charts that'll make it easier to remember. So this picture just shows the ability of an infant to grasp an object, which happens about age 2 to 3 months. This baby is demonstrating a crude pincer grasp, approximately 8 to 10 months old. And then we have a baby that is showing the neat pincer grasp. She is using her fingers to pick up an object. This happens at approximately 11 months old. Gross motor movements, or the big movements, are also changing rapidly in the infant stages. Again, refer to the table 10.4 in your book and in the ATI book for some of these milestones. For example, infants learn how to control their head. This is established well by 4 to 6 months, but it starts a little bit at birth. They can roll over 5 to 6 months. Usually it starts with the abdomen to the back at 5 months. Back to the abdomen is a little bit harder for them to do. They can sit alone at about 7 to 8 months unsupported. They can move at about 10 months old where they're either crawling or scooting and pull themselves to a standing position 11 to 12 months old. This picture shows how head, leg, and head control develops in just a few months. The first picture on the top, the baby has complete head leg at 1 month old. In the middle, 2 months old, it's just partial head leg. And then the third picture at 4 months old, there's almost no head leg at all. That neck is getting stronger. Infants are funny because when they start to actually start moving, they go backwards because they can use their upper arms better than their lower arms. So when they start to scoot, they push with their arms and they go backwards. Crawling usually starts between 6 to 7 months, creeping 9 months, walk with assistance at 11 months, and then walking alone around age 12. Now remember, if you're a parent or you have been around infants, this is all just milestones that are set by the book and ATI for development. Certainly babies can walk earlier and can walk later, and they're perfectly normal. It's just important to know what the developmental milestones are for when a baby comes in to see a physician and to be able to recognize any potential problems. This photo from the book just shows some different locomotion movements by infants, standing up alone with assistance, pulling themselves up on furniture, crawling, etc. I'm sure you all remember Erikson's psychosocial development from psychology class. For infants, the phase that they're in is trust versus mistrust. They must have their feeding, comfort, tactile stimulation, and caring needs met right away. If they don't, then they earn a sense of mistrust with their caregiver, and of course can develop a unstable relationship between the infant and the caregiver. Um, it's very important to have consistency of care and meet their physical and emotional needs. They're too young to understand that if they wait a minute, the caregiver will be coming. They don't understand that, so they need to have their needs met right away. For cognitive development, there's a ton of changes. I wouldn't worry so much about the really early months because in the reflux stage, the infant is crying, swallowing, and sucking. And then when they get up to 4 months old, they have some voluntary acts where they're anticipating feedings. As they get a little older, like around 6 months old, they're able to actually imitate adults and those that they're interacting with sounds and simple gestures, because so then it gets fun. They can play peekaboo and play some games like that. They can play with rattles and shaking and banging and pulling on things. So it's pretty fun as they get a little bit older and are able to smile and interact with you. Another thing that happens cognitively is around 4 to 8 months, they learn separation anxiety. So they get very upset when they are removed from their permanent caregiver. Believe it or not, infants recognize that they're distinct from their parents by the age of 1 year old. They also enjoy putting everything in their mouth. That's their area of pleasure. So they'll put their fingers, they'll put their toes. They also really like looking at themselves in a mirror. That gives them great pleasure as they get a little older. This little guy is enjoying looking at himself, just like I just spoke about. It's a really easy game to play with infants, and putting them in front of a mirror so they can interact with themselves. Infants obviously have a lot going on socially as well. Parenting is a learned, acquired process. It's not instinctual for everyone. So, um, reactive attachment disorder happens when the psychological and developmental problem lies between caregiver and infant. Maybe there's neglect, maybe there's abuse, and when that happens, the infant actually, it can affect their growth and development. They become sad, listless, withdrawn. Remember that they're looking for trust, and if that doesn't happen, they may not grow and develop properly. When I was a school nurse at Lewis and Clark, there was a fifth grader whose name was Wesley, and he looked like, when you met him, about the size of a first grader. He was absolutely tiny, and the story behind him was that when he was born up to the age of 2, his parents completely ignored him. They didn't talk to him, they didn't nurture him, and then eventually he went into foster care. So his growth was stunted physically, psychologically, mentally, all of the above. And he acted like a first grader as well. So I always think of Wesley when I think of reactive attachment disorder. Infants increasingly get attached up to 6 months old, and then remember, separation anxiety can happen about 4 to 8 months. They obviously prefer to be with their primary caregiver. If they leave the room, they notice and they become extremely upset. Stranger anxiety, where they're just scared of other people they don't know, happens about 6 months old. And then keeping in mind, as I talk about all the time, play is the work of childhood. Play provides stimulation to learn from interactions with the environments for infants. So that's very important for their growth and development. Infants are communicating right away by crying. That's how they communicate with us. Vocalizations start about 5 to 6 weeks old. Cooing, gurgling, laughing by 4 months old. Again, they can imitate sounds by 6 months. Understand the word no by 9 months. Starting to combine some syllables, mama, dada, at 10 to 11 months. Quade's first word, I think I told you this, was backpack from Dora. So no mama there. And then by age 1 year old, they should be able to say 3 to 5 words. Personal and social behavior refers to the child's response to the environment. Certainly, infants are completely dependent on caregivers for feeding and changing their diapers, but they start to interact with adults right away. They can smile at about 6 to 8 weeks. And then remember, 6 months is kind of that milestone where they become really personable and are able to play simple games with caregivers. Infants play, the definition of their play is solitary play. They play with their toys by themselves. They really don't interact with anyone else. They're pretty narcissistic in that aspect. They don't share toys. They just want to play alone. As they get older, 6 to 8 months, if it's someone that they don't know, they're going to have that stranger fear, which I mentioned before, and they're not going to want to play with someone they don't know. Infants do have very different temperaments. I believe that it is biologic and influenced by their environment, by family, but unfortunately, you can have an infant that just is not a happy baby, and that can be very frustrating for caregivers. In fact, it can become so frustrating that this is where horrible things like shaken baby syndrome happen. If you have a baby that is constantly unhappy, it gets very frustrating. So nurses need to help parents identify the temperament of their baby. There are some tools and questionnaires that will help identify the behavior style of the infant. And then nurses would help parents with this information and offer guidance and techniques to diminish that frustration and be able to cope with their baby in a more beneficial way. I've talked about separation anxiety and stranger fears a lot already. Boy, it must be important. We want infants time to safely experience strangers. So remember, when you're working with infants, get to their level, use a quiet voice, soft touch, keep them in the safety of their parents' lap to do any type of assessment. Believe it or not, limit setting and discipline can definitely start at this stage in infancy. They understand a negative voice. So if they're doing something they shouldn't, you say no. You look them in the eye, be very consistent and nurturing afterwards. They need age appropriate discipline. So certainly, should we try a timeout, it wouldn't be for a 3-month old. I would say it would be in the later months, 11, 12 months old. And then truly, it needs to be in a safe area, free from toys in the hallway, a minute per age. So they're just going to sit there for a short time. Maybe you designate a specific naughty chair so that they sit there, and eventually, after repeated consistent discipline, they'll start to understand that that's what that chair is for and that it's a negative consequence. I just wanted to mention spoiled child syndrome because I heard a lot with even my own kids. Spoiled child is a response to inconsistent discipline and limit setting. Babies need comfort and cuddling and getting their needs met. This is not spoiling. There's really no evidence to support this syndrome at all. Remember, the mouth and sucking is a pleasure for infants. They may not just be satisfied with bottle feeding or breastfeeding. They may want to suck on their thumb or use a pacifier, which is normal for infancy up to early childhood. Um, it's important, especially for pacifiers, that safety considerations are looked at. There's no decorative objects that can be easily choke the child or come off. Um, and recommending weaning from the pacifier the second 6 months of life. So this picture shows an infant with just a plain pacifier, no decorative ornaments on there, and it perhaps was used to help the child after feeding to fall asleep. Um, they tend to use them more often when they're hungry, tired, or feeling insecure. Teething often occurs during the first year of life. Um, Teething can cause inflammation, so cold is soothing. Can give them cold teething rings to kind of suck on to help with comfort. During the first 2 years of life, we can take the age of the child -6, the age of the child in months -6 to get approximately the number of teeth that they should have. So for example, if you have a 10-month-old, you take 10 minus 6, they should have approximately 4 teeth. Obviously, breast milk is best for babies up to 6 months of life. If a mom chooses to use formula, that is her choice. We support those decisions. Introduction of solid foods begins about 4 to 6 months old, not before, because the digestive systems for these infants, they're just not ready. They're not mature enough. Usually the very first thing that should be introduced is an iron fortified formula. Iron fortified cereal. Most of the time these cereals, you combine them with breast milk or formula and start with that first. Introduction of solid foods should do one food every 4 to 7 days to allow for the identification of any food allergies. After iron fortified cereals, typically start with some veggies, fruits, and then meats. Contrary to what most people believe, babies do not need additional water in their diet. Excessive water can actually cause water intoxication and upset their electrolytes. Juice also brings empty calories, so they really don't need juice in their diet either. We never microwave breast milk or formula. We thaw it in a warm water bath. And then gradually, as the infant gets within that 1 year time frame, we're trying to wean them off of their milk and bottle and start to give them a sippy cup and whole milk. The bedtime feeding typically is the last one to be stopped when you're weaning a child from the bottle. I have an interesting story. My nephew was over 2.5 and still taking a bottle for every feeding or every meal. And he was walking and talking and doing everything else a 2-year-old should. So he came to visit me at the lake one weekend, and I threw his bottles away, and I told him they were all gone, and he was completely fine. It was more of a parent convenient thing for the parents than for the child. He was totally ready to be done with them. So if you need your child to get off the bottle, just let me know. I will come over and do that for you. This picture just shows examples of different types of baby food that are available commercially to buy. There's a million different types. Some are good, some are not so good, but there is a great variety to choose from. Sleep and activity is always a hot topic with infants. They should sleep approximately 14 to 15 hours a day, and as they get older, that gradually decreases. The book says by 3 to 4 months, there should be a sleep pattern established. Some of you who are moms are probably rolling your eyes at me. But in theory, at 12 months old, baby should be able to sleep through the night and may require 1 to 2 naps a day. We'll talk more about sleep problems later, but it's important that babies are put on their back to sleep and that their sleeping arrangements are alone with no extra bedding, stuffed animals, etc. in the crib, and that there's no co-bedding or sleeping with the parents allowed. This picture shows the perfect positioning for an infant to lay in the crib on her back with no extra blankets or stuffed animals around her. Dental health is important with infants, believe it or not. Start with just wiping teeth and gums with a damp cloth, and then progress to toothbrushing with water at first. At 6 months old, we can start to use some fluoride. We want to make sure that first dental visit is within 6 months of life, at the very latest 1 year old. Avoid propping bottles and juice with or milk before bedtime or nap time because that promotes dental cavities. And then assessing the tap water is sufficient for fluoride, because if it's not, then we may need to do some sort of fluoride supplementation. Unfortunately, injuries are a major cause of death for infants, especially in that 6 to 12-month-old range. Aspiration of foreign objects, especially when they become mobile. We have to be careful with having small objects, toys, buttons, coins, laying around that they can put in their mouth and choke. Suffocation, plastic bags, pillows, toys in the crib, all of those should be kept away. Motor vehicle injuries, I'm sure you can understand, happen when they're not properly secure in the car seat. Infants should always be in a rear-facing car seat in the middle of the back seat of the cars. With that comes, of course, the tragedies where I actually had this happen when I was working in a recovery room. A dad put his infant behind the car to help another child buckle in, and he forgot the baby and backed up over the baby in the car seat. And then you always hear the stories about parents that are leaving their babies in the back seat of an overheated car, and they unfortunately pass away that way. Because they start to be mobile, we worry about falls, so having gates near stairs, keeping the crib in the lowest position. Burns happen from heating formula in the microwave, bath water that's too hot, pots and pans that have hot substances in them, not wearing sunscreen, and then also not putting outlet covers on the outlets so baby sticks something in the outlet or puts their finger. And then drowning is also a common occurrence with infancy, made in a bathtub or a bucket because they're unintended and not being watched. Another one that I mentioned last week is animals, not to leave the infant unattended with an animal, even the family pet, because you never know how they may react. Can't stress the importance of this one. Infant car restraint, under 2 years old, back seat, rear facing, in the middle of the back seat. So what do nurses do to promote home safety? Lots and lots of education. No pillows, stuffed animals, extra blankets in the crib. Crib at the lowest level. Crib slats should only be 2.4 inches apart. Never tying a pacifier around an infant's neck. No open water sources, tubs, buckets, toilets, pools. Electric outlets are covered. Stairs and doors are protected with gates or those plastic doorknob things that the infants can't turn. Toxic substances, medications, makeups should all be out of the reach of infants. Pets should be restrained and immunized. Fenced yard, of course, and making sure that they're in the back seat, rear facing. That ends chapter 10. We will move on to chapter 11. Chapter 11, we're going to talk about a few common health problems of infants. Food sensitivities, failure to thrive, and colic will be the main ones. Food sensitivity refers to an adverse reaction to food or food additives. Most children outgrow these allergies or intolerances by the age of 1, but children who have one food allergy are greater at risk for getting others, especially to milk and eggs. What kind of symptoms can a child have from a food hypersensitivity? Well, really anything from a minor rash, a cough, abdominal pain, vomiting, cramping, all the way up to an anaphylactic reaction where their airway is closing off and it's a medical emergency. So what's the most common allergies? For children, it's eggs, cow milk, and peanuts. As they get older, may develop allergies to soy, wheat, corn, tree nuts, shellfish, and fish allergies. And then atopy means that there is a family history of an allergy. So if dad is allergic to peanuts, then it's more likely that the children will be allergic to peanuts as well. Breastfeeding for 4 to 6 months does help avoid some of that hereditary tendencies. What do we do for a serious food allergy? There's different treatments, and I think it's still a common mistake to think that if someone's having allergic reaction, you treat them all the same way. I need you to know that any type of reaction that has itching, a rash, hives on the extremities or torso, that can be treated with Benadryl. That is just a antihistamine reaction, not life-threatening at that point, so that can be Benadryl. If it's an anaphylactic reaction, that's anything to do with the face, swelling, hives, throat feels itchy, feels like it's closing off, that is an anaphylactic reaction and an emergency, requires epinephrine, so the child should have an EpiPen at school, requires an emergency plan at school, like an allergy plan. The child should have a MedAlert bracelet on at all times. So what kind of reaction is this kiddo? He's having an obvious anaphylactic reaction. See the swelling of the lips? That is very concerning for me. This would be treated with an EpiPen. Could you give Benadryl too? Sure. It's not going to hurt anything, but it definitely is not going to be enough. We have to have the EpiPen as well for that facial swelling. This poor little girl, same thing. Before and after pictures, look at the swelling of her face. I'm very concerned about her airway closing up. We would give epinephrine. Itchy hives and rash, what would you give? For this instance, we could try Benadryl. As long as the child is not complaining of anything with the throat, itchy, scratchy throat, trouble swallowing, Benadryl would be fine for this type of rash. So remember the two distinctions. Benadryl for skin, epinephrine for anything more serious with the throat and the face. Next two problems with infants, we're going to talk about feeding difficulties, failure to thrive, and colic. Failure to thrive is diagnosed for an infant who's less than the 5th percentile for weight on those growth charts that we talk about a lot. Their height may be within normal limits, but they're grossly underweight. Why is that? The number one cause is inadequate intake. This may be from organic or non-organic reasons. Maybe they have reflux or GERD, pyloric stenosis that causes them to vomit up every feeding. Maybe the parents are not preparing the formula correctly according to the instructions. Perhaps there's an attachment disorder that we talked about between the parents and the child, so he's not eating enough. Maybe there's neglect, developmental delays. There's a lot of different risk factors. So the number one thing that we want to do is reverse the cause of the failure to thrive. We want to be very persistent when feeding, introduce new foods slowly, remain calm, have a very non-stimulating environment, very calm feedings, and maintain a feeding schedule. As nurses, we have many things that we can do to help the parents. We take a nutritional history, observe the parent-child interactions, teach about those proper feeding techniques and how to mix formula correctly, establish that eating routine that is consistent, and perhaps supplements for vitamins and minerals would be appropriate. And then certainly we encourage parents and support them, because even if it is inadequate preparation of the formula, they may feel very guilty about that. It's not that they're trying to harm the infant or neglect them. So we're going to be supportive and give them lots of education and teaching. I am sure most of you have heard of colic with babies. This is abdominal pain or cramping that is manifested by loud crying and drawing the legs up to the abdomen. These babies are not happy campers. Usually occurs within 1 to 2 weeks of life and subsides at 16 weeks. So it can be very frustrating for the infant and the caregiver. It is diagnosed with a cry greater than 3 hours a day, occurring more than 3 days a week, and lasting for more than 3 weeks. It is very common in infants under 3 months of age, and it usually, as I said, spontaneously resolves itself in 3 to 4 months. The problem is that's a really long time, and caregivers can get very frustrated, and this is where the baby is at risk for shaken baby syndrome. Caregivers are exhausted and are not sure what to do. So as nurses, we will educate them on feeding the baby slowly, burping frequently, keeping them upright during feedings, swaddling them, applying gentle pressure to the abdomen, and massaging the back while they're lying down. Educating breastfeeding mothers to avoid foods that are prone to cause stomach problems, such as cabbage and onions. Sometimes medications like Mylicon drops can also be very helpful, so that's something else that we can teach caregivers to use. Remember that crying is the communication of infants. As you get to know your infant better, you can tell if it's a hungry cry, a dirty diaper cry, or a pain cry. And for colic, it's definitely a pain cry, which if it lasts up to 3 hours can be so frustrating for those caregivers. They just get exhausted. So we really, as nurses, want to support them and teach them if they're getting frustrated to just go place the baby in a crib where they're safe and just walk away for a few minutes. We are going to fast forward here now to chapter 32 for just a few pages to talk about skin disorders that are common with infants. The first one up is diaper dermatitis, otherwise known as diaper rash. This is an acute inflammatory process that happens with prolonged contact with an irritant. Usually with babies, you know it's urine or feces, but it could be a detergent or a soap that is causing them problems as well. Usually we find reddened, inflamed skin in folds of the buttocks and inner thighs. Therapeutic management is to apply a skin barrier, maybe zinc ointment, hydrocortisone cream, petroleum jelly. We teach parents that with each diaper change, you do not completely remove that barrier cream. You basically just remove the waste from the top and add another layer, so you're not always scrubbing the skin. If you do need to wash the skin, just use plain water or a non-soap cleanser. Also, very important to use a super absorbent diaper so that it holds more moisture, and change the diaper as soon as it's soiled. Expose the skin to dry air. And sometimes if the infection turns to, or the rash turns to an infection, it's typically caused by some sort of yeast or fungal. So there may need to be some sort of doctor prescribed medications like Lotrimin or antibiotics or steroids that is applied to the area. Number one is to prevent it. Super absorbent diaper, expose the butt to air, and then using the barrier cream and not wiping it off completely with each diaper change. Here is a picture of diaper rash from the book. As you can see, all the areas that are red and certainly are irritated and need to have some sort of barrier cream. Up next is atopic dermatitis, otherwise known as eczema. This is a chronic inflammatory process that can happen with as early as 2 to 6 months old. Associated with a very itchy rash to the skin, usually associated with an allergy and atopy, which remember is there's a hereditary link to eczema. This can't be cured, it's just controlled. So we'll talk about that in the next slide. Here's a picture of a baby that has eczema on their cheeks. Again, starting anywhere from 2 to 6 months old. We want to keep the skin very hydrated, avoid irritants such as bubble baths or harsh soaps. We want to use a tepid bath water, cotton clothing. We don't want to overdress them so they get too hot. Helpful to use a humidifier so the air is less dry. We want to relieve the itching. So sometimes we may have to use topical steroids or oral medications such as Benadryl, Claritin, Vistaril. Wet compresses on the affected areas also can help with comfort. We want to prevent and control secondary infections. How does that happen? Well, when you have an itchy patch of skin, you want to scratch it, right? So we try to avoid these infants from scratching, because if they do that and get a secondary infection, then they may need to consider antibiotics. We keep their nails short, we wash their clothes in mild detergent, and again, avoid overheating cotton clothing. Diphenhydramine is the medication for choice, especially at bedtime, because it makes them sleepy and it stops the itching, so it's a win-win. Seborrheic dermatitis is another chronic recurrent inflammatory reaction of the skin. Most common on the scalp of infants, that's called cradle cap. but it can happen in other areas as well. For this one, the cause is unknown, so there really is no family history. But what we do is adequate scalp hygiene. If there's lesions present, we wash the hair with a baby shampoo, or you can use an anti-seborrheic shampoo. And then we use a soft bristle brush or comb to remove the scales and crust from the scalp. This shows an extreme case of cradle cap, but again, minor cases are very, very common in infants and can be easily treated. Both my kids had this, and within a couple weeks of just gently scraping their scalp, it was gone. We are back to chapter 10, talking about sleep problems that we mentioned earlier, but now we're going to get a little bit more into it. On page 384, there is a table that lists sleep disturbances in your book. Sleep concerns are common in infancy. They have nightmares and dreams and trouble falling asleep just like we do. So you can read about those. It's not something that I'm going to test you on as far as the different types. It's just if you're interested, you can read about them. What's most important is just placing them on their back to sleep with nothing else in the crib. The final two areas that we're going to talk about with infants is sudden infant death syndrome and plagiocephaly. Sudden infant death syndrome happens when there's a sudden death of an infant less than 1 year old with really no underlying diagnosis. It just happens. They die in their sleep. And then plagiocephaly happens when the head of an infant lays in one position for a long time and it starts to become asymmetric because their cranial molding is happening. So we want to talk about ways to prevent that from occurring as well. What makes a baby at risk for SIDS? Well, if they've had one or more episodes of apnea or CPR after birth, if they were born preterm, if they have two or more siblings that have had SIDS, and if there's smoking in the house, that's another risk factor, as well as co-sleeping, meaning that they're sleeping with the parents in the same bed. Additionally, if the infant is a low birth weight, they have low APGAR scores, they sleep on their stomach, there's alcohol use in the family, they're of the male sex, they're more at risk for SIDS, and those of Native American or African American ethnicity are also more at risk, or if they've been recently ill. So what is common teaching to avoid SIDS or to try to lessen those risk factors? No smoking during pregnancy or near the infant. Breastfeeding has been found through research to lower the risk of SIDS. Sleeping on their back, having a firm mattress with no other blankets or pillows or stuffed animals in the crib, not sharing a bed with anyone else, not overheating during sleep, so just keeping them in their pajamas, no extra blankets. If for some reason this does happen, unfortunately, I've had a few friends in my lifetime that have lost their babies to SIDS. It's really important as nurses to allow those families to say goodbye and to grieve, hold their baby in the emergency rooms and rock them for as long as they want to. Obviously, it's unexpected. There's no one to blame, but it is certainly a horrible experience. So we allow them, family, to say goodbye and to grieve in their own way. Quickly, one slide on plagiocephaly, asymmetric head. So with the Back to Sleep campaign came plagiocephaly. When I was young, 13, 14, babysitting kids 30 years ago, we always put babies on their stomach. Now things have changed, putting them on their head, that area that they're laying on that always has the pressure on their scalp becomes flat. So it's an acquired condition, which happens with cranial molding. We want to make sure that the babies have tummy time every day while they're awake, 30 to 60 minutes a day. Alternate the side of the head they're sleeping on every night, and just giving parents a lot of education about these two things. If it's a very severe case, sometimes the infant needs to wear a special helmet 23 hours a day for about 3 months, and there's pictures of that in the book, to just help mold that scalp back into place. All right, let's talk about the toddler. This is any child 12 months to 36 months or 1 year old to 3 years old. The other name for this time period is the terrible twos. I'm sure you've heard of that. This is a great time of exploration for these kiddos because they are moving, they are interested in everything, they have no fear, so they think everything is up for grabs and can be touched and put in their mouth. And so they need clear guidance and limit setting from adults to keep them very safe during this time period. Growth happens a little bit differently than in the infant's period. Remember, that was very steady and very quick. Everything slows down just a little bit for toddlers. They still have a steady growth curve, no doubt. They gain about 4 to 6 pounds every year. By their 2.5-year mark, they're about 4 times their birth weight. Height increases 3 times a year, and it's a step-like pattern for their growth where they may grow really fast and then kind of even out and then grow fast again, kind of have these little spurts. Their head and chest are equal in size by age 1 to 2 years old. Remember, during this time period that fontanelles start to close, the anterior fontanelle closes at 12 to 18 months. Sensory changes are very heightened during this toddler period. They like to touch and taste and smell everything and explore everything. So they need to really be watched and supervised. And their vision is 20/40. So what a normal person can see from 40 feet, they can see from 20 feet. And that is very normal at this age. By the end of toddlerhood, most of the body systems are relatively mature. The brain is 75% completed with its growth. The area that's still concerning is the respiratory system, particularly the ears, nose, throat. Those structures are really straight and short in the toddler, so they are at great risk for ear infections, upper respiratory infections, and tonsillitis. By 18 to 24 months, they can actually start to control elimination, which is page 403, table 12-2 in your book is focused on gross and fine motor developmental milestones. Number 1 for these kids is locomotion. They are moving and grooving. Be sure to look at the different age groups for fine and gross motor movements. Improve coordination by the age of 2 to 3. Fine motor, they're able to throw a ball by 18 months, etc. There's lots of memorization there, but it is something that ATI likes to ask. For Erikson's development, toddlers are in the autonomy versus shame and doubt. They want to be independent. It's very paramount to them. They want to get dressed by themselves. They want to feed themselves. Their behavior is their own. What happens when they can't do some of that is they get really frustrated and they feel like they've failed. Also very common in this age is negativism and ritualism. Everything that you ask a toddler, the answer is going to be no, 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 no. Ritualism means that they like to eat the same food with the same plate, with the same fork every day. It's a sense of security and comfort for them. They are very egocentric. Everything is about them. But with that, they're able to separate from parents a little bit easier than the infants, control their bodily functions, and communicate. So there are definitely lots of developmental milestones that happen psychosocially as well. Number one achievement in toddlerhood is the achievement of language. They start to talk a mile a minute. They recognize cause and effect, like if you switch this switch up, the light goes on. They understand object permanence, that's fully developed, so if mom leaves the room, they know that she still exists and that she will be back later. They understand shapes and the relationships to each other. So lots of cognitive development too. One kind of fun thing that toddlers do is domestic mimicry. They like to imitate behaviors of what they see. So if mom is sweeping and washing dishes, they like to do that as well. Play house, help with cleaning, help set the table. They don't understand time. So again, we have to think about what we say to toddlers because they don't understand when you say just a minute. They don't know how long a minute is. So we need to talk to them at their developmental level. Here's an example of domestic mimicry where the child is helping dust. And it's really good for them to feel that, again, it's autonomy versus shame and doubt, that they're independent and doing something that is helpful, in quotation marks, to mom and dad, gives them a sense of accomplishment. Toddlers are very egocentric with their communication. It's all about them. I want this, I do that. They only view things from their point of view. That's a self-satisfying behavior and part of their socialized relationships at this age. Begins about age 2 years old. I can't stress that consistent discipline any more than with the toddlers. Remember, they're egocentric, so they think that if they do something and they're not punished for it, that their action is good. Okay, let's say they steal a cookie and they weren't supposed to, but nobody says anything, then that action is fine. If they do something bad and they're punished for it, like given a timeout or a stern talking to, then they learn that that was bad behavior. Giving explanations for bad behavior and giving consequences works for toddlers. I can't stress enough that consistent discipline for toddlers. They are so egocentric that if they do an action and they don't get punished for it, it must be a good action. That's what their thinking is. For example, if they steal a cookie off the table and nobody says anything, they don't get punished, that action was good. If they do something like that and are punished for it, then they understand consequences. So giving explanations for bad behavior, giving consequences, or reversely giving rewards, then you have a better outcome with them understanding good versus bad behavior. In the toddler stage, they definitely start to identify their body parts by name. We want to be very careful using negative labels about physical appearance, such as chubby or skinny, starting as young as toddlers, if you can believe it or not. They also begin to recognize sexual differences by the age of 2. The book says that a sense of gender identity is established by the age of 3. So they understand kind of gender roles between boys and girls. They also find touching pleasurable. This goes for really all age groups, even infants. So exploration of genitalia is common. This goes for a little bit older age group, but When I was a school nurse, I had a kindergarten teacher, so the child was about 5, who had a girl in class that was masturbating at the age of 5 in class and having orgasms. So imagine the conversation I had to have with mom about that. So it is very common. It's part of life going back as early as infancy. Socially, toddlers learn that they can leave their parents and what sets them apart from others. They know that when they go to bed and wake up, their parents will still be there, and they start to recognize their own identity and what makes them different from others, not just as far as gender, but as far as their likes and dislikes as well. Once they start talking, they never stop, believe me. Toddlers have more than 300 words in the vocabulary by the age of 2. They understand and comprehend more and more of what is going on around them and the communication that's going on around them. Something I think that's important to recognize is that language delays can happen with technology and television watching. They should never watch more than an hour a day. Remember, these little people want to be independent and do everything themselves. So I think as parents, when the kids are this strong-willed, we need to pick our battles. If they want to feed themselves and it takes an hour longer, is it really a big deal? They want to dress themselves and they put their shoes on the wrong feet, is it really a big deal? When it becomes a big deal, we need to just be consistent again with our explanations, positive reinforcement, redirection, and possibly timeouts 1 minute per age if appropriate. Play. Are you sick of me talking about that yet? Remember, infants play by themselves, solitary play. Toddlers, age 1 to 3, play parallel play. They play alongside other children, but they really don't interact together. They like all kinds of push toys, tactile play like water toys, sandboxes, finger paints, puzzles, but we have to be very careful with toy safety. Again, because of their sense of exploration, they put things in their mouth, so no small toys or toxic substances should be allowed. This is a picture of what's supposed to be parallel play. So they're playing out of the same box of toys, but they're playing by themselves and just next to each other. Parallel play. All right, we're on the home stretch. Let's talk about some concerns related to normal growth and development with these kids that are in the toddler age group. First up is toilet training. How do you know your child is ready? Well, they need to be showing an interest. Are they curious about your toilet habits or your other kids' toilet habits? Do they want to try to please you? They need to be able to stay dry for at least 2 hours and show that they're able to control their bowel and bladder sphincters. They need to be able to remove their clothing. Otherwise, toilet training is going to be really hard. Do they not like being wet or having a soiled diaper? That's a big clue as well. I think the key here is not to push it. Parents really, I hear this all the time, they want them to be toilet trained by 18 to 20 months, and they're just not ready, and that's okay. Girls tend to be ready a little earlier than boys, about 2 to 2.5 months earlier, but that's not always the case. So practice 5 to 8 minutes at a time. Don't push it, offer rewards, knowing that bowel training usually happens first. And then once you get the bladder training, they may still have accidents during the night. Nighttime bladder control may take several months to master after daytime control is complete. Buying the child their own fun toilet seat might help them become more interested. So this picture shows an example of that. He's got his own toilet seat. This picture shows the child sitting backwards, which may look kind of funny, but I've seen in some books that they give the child a dry erase marker. so that they can draw on the toilet seat while they're sitting there to kind of help pass time and train the bladder. So I think that's kind of a cool idea. Sibling rivalry happens when there's a new baby coming into the family for this toddler. They may feel stress, like they're dethroned from their position of being the only child. So it's really important to get them ready for the new baby, preparing them, getting them to understand what's going to be happening. Perhaps you use a doll to help take care of the baby in quotation marks. And then once the baby comes, they can help, of course, with supervision to take care of the baby. And it's still really important for mom and dad to have quality time with the toddler alone while the baby is sleeping. This picture shows a perfect example of a toddler being able to help care for baby with assistance and supervision from mom because they don't have boundaries. We never want to leave a toddler alone with the infant unsupervised. Temper tantrums. Oh my gosh, yes. These kids have them. Completely common. Had a little guy in cleft lip palate that the parents were frustrated with his temper tantrums. Well, he was 2 years old. It is what it is. They're trying to assert their independence. If they get angered and distressed, they start to kick, scream, hold their breath. It might be in church. It might be in Walmart. It might be at home. They have no boundaries. So what can you do? Usually temper tantrums last less than 5 minutes. So we just ignore it. How do we prevent them? Well, keeping a consistent routine. Don't go to Walmart when it's lunchtime and they're hungry. Don't go to Walmart when they're tired or when they're not feeling good, because that's when you're going to have a problem. Be very consistent, again, with discipline, calm during the episodes, not paying much attention to it, but obviously making sure that they're safe. Offer options. I talked about picking battles. If it's really not a big deal, if they put their shoes on backwards, then let them do it, okay? When they're done with their tantrum, we give them comfort. If they make a good option, like if you give them a choice of 2 types of crackers that they can have and they pick one, we offer praise for positive behavior and positive reinforcements. Oh yeah, this is at Walmart for sure, right? It always happens in public. Those of you without kids, you're gonna think it'll never happen to you, but it will. And so when you see another parent dealing with this at Walmart, you just feel sorry for them and walk away, let them deal with it because it's embarrassing and they're stressed. And now you know that it's a normal part of toddlerhood. No, those 2 letters are what you're going to hear come out of the mouths of toddlers all the time. Do you want to go to bed? No. Do you want to have a snack? No. Do you want to go to school? No. So how do we avoid that? We don't let them have the opportunity to say no. Give 2 choices. Do you want an apple? Do you want an orange? Reduce the opportunity to say no. Stay in routine. Stay calm and reassuring, and let them know their expectations for behavior. Nothing else works. Toddlers get to be pretty picky eaters. That's where this physiologic anorexia happens. They're not real hungry, and they do have a decreased nutritional need because they're not growing as much. They might have really sporadic eating. So what do? Offer nutritious snacks throughout the day, not just junk. Offer small portions at mealtime, okay? A serving size for a toddler is 1 tablespoon of solid food per year of age. Again, ritualism. They're going to want their favorite foods every day, every meal, same cup, same spoon. Pick your battles, okay? They're not going to starve if they have mac and cheese 3 days in a row. Obviously then, you would offer an apple for snack time or a banana or some green beans, whatever, just to get them their nutrients. Sleeping, they have a lot of night waking and fears are common. They should sleep 11 to 12 hours a day, possibly with one nap during the day. Keeping a routine is really helpful to promote sleep. Not watching TV before bed. Maybe reading a book, something non-stimulating. No TV, a warm bath, no bright lights. During this time, they also transition from their crib to a bed. So that is a big developmental milestone. We're really concerned about the dental health of toddlers. They get all of their baby teeth by the time they're 2.5 years old. So they should definitely have an established dentist by the time they're 1 year old. After all meals, bedtime, snacks, we should work hard to remove plaque and brush their teeth with a fluoridated toothpaste. Check the water supply. If it is low on fluoride, then they may need a supplement. Parents need to still help brush teeth. They're too little to do a good job. Let them do it themselves first, and then you get a turn. Watching what they snack on. We want to be very careful of high sugar diets that cause a lot of tooth decay, such as sticky things, honey, corn syrup, candies, suckers, things like that. Here's a extreme picture of early childhood caries. Number one is always prevention. That's why we preach to parents not to put juice and milk in bottles at nap time or when the child's sleeping. I've seen kids in the shopping cart at Target with Mountain Dew in their bottle to keep them happy. But of course, then they're at increased risk for dental caries, which can be very significant. Last but never least, we always talk about safety. This is very similar as with an infant. Toddlers should always be in an appropriate car seat, in the back middle seat of the car. We need to be careful about open pools of water. Burns, now when they get a little taller, they can actually reach those pots and pans off of the stove and have a scald burn, which is very, very common at this age. So making sure that the handles are turned to the back of the stove. Poisoning, they're curious. They're going to go and put everything in their mouth, plant, makeup, medicines, keeping it out of their reach. Still need gates, locks on the doors. Careful of all small objects that they can put in their mouth. Not putting them in the front seat. I forgot to mention this because of the airbags. That can be fatal for a small toddler. If we put them even in their car seat, in the front seat forward facing, and the airbag goes off, that's supposed to be a safety feature, right? But it can kill a small child. I also talked a lot about co-sleeping earlier. I know that we all want to sleep with our cute, cuddly babies, but it's also really dangerous. Not only does it increase the risk for SIDS, but a few years back, a family that we go to church with, the dad was sleeping with his toddler, and the baby fell, well, toddler fell in between the headboard and the bed, and the dad didn't wake up, and the baby suffocated. So it's just a good idea not to do it. Imagine the guilt that dad felt. It was really, really horrible. I think the child was maybe 1 to 2 years old at the time. So anticipatory guidance for families of toddlers. Lots of teaching about safety, the importance of play, praising their success. Remember, parenting is not a God-given behavior. I mean, it takes a lot, and if a parent is stressed out, especially with toddlers being so busy and independent and negative, they might be really frustrated. So we need to give them sound advice and support them, and give them all the teaching on the safety, limiting opportunities for them to say no, discipline, all of that, just like we do for every other group. Now, before you go, I'm going to talk to you about the assignment because I didn't mention it in class. So you have until, I believe, October something for this Ages and Stages assignment. It's October 14th is when it's due. So it sounds like a long ways away, but there's some work that's put into it. So make sure you read about that. You can do this assignment by yourself or with a partner. You need to locate a person in Minot that has a child that's younger than 60 months old, 5 years or younger, and you cannot use your own child. You can use each other's, but you can't use your own. Have the parent complete the Ask 2 and 3 questionnaires, which you will get from me. Review the answers, and if you're working in partners, you're going to find 4 teaching topics for this family. If you work by yourself, you do 2 areas of education. You're going to write a teaching plan any way you want to about the topic, and then you're going to find 1 handout that you're going to hand in with your project. Sounds confusing, I know. So this is what I want you to do this week, sometime. I want you to email or text me the age of your child. That's it. I need the exact age in months, and I will get you the appropriate questionnaires. Again, you can have a partner or you can work by yourself and get a hold of me for the questionnaires. I will get them to you as soon as possible. Okay, potential ATI questions from all of this that we just went over. You need to know injury prevention for toddlers. We talked about that a lot. Developmental findings to report for toddlers. So you need to know what's normal for them. Fine motor, gross motor, all of that. Parent understanding of diaper rash. How do you know that they understand what you're teaching them? Risk factors for failure to thrive. Teaching about home safety for infants. Health promotion for toddlers. Negativism. We talked about that quite a bit. Evaluating a client understanding of SIDS. Complications of infants. Planning and teaching about failure to thrive. What else? I think that's it. Okay, so if you have any questions, let me know. This test will be on Monday the 30th at 9 a.m. in room 308. All right, bye-bye.